Dr. Scott Sherr, October 17th and 18th. We're coming to Boulder, Colorado, your neck of the woods.
I'm so excited that I don't have to travel for this one. And it's the most beautiful location to have a symposium, Boomer. I'm super excited. It's going to be in October when the leaves are going to be changing. The mountains are going to be crisp. It's going to be beautiful.
So from an evolutionary perspective, we would call this the free energy principle or energy of activation. And what Scott just said there is a big load of text to cloud the fact that he just doesn't want to move and conserve energy. But
Indeed.
It will be a fun time. And what I love about our symposiums is that every year, and we've been doing this for a couple of years now, we get together and really talk about cutting edge topics in health optimization. This year, we have some really amazing guests, a lot of people from the Colorado area, but also just in general, thought leaders within the longevity space.
Yeah, I'm excited for it. I mean, we have a really great community in Colorado overall. People like to live there because there's the mountains, there's skiing, and then we have lots of things to do in the summer as well. But the group that's coming together here is very special. We have one of my good friends, Dr. Elizabeth Yurth, she runs a place called Boulder Longevity. That's in Boulder, of course. And she's one of the GOATs, like the greatest of all times when it comes to longevity medicine. She's
also been practicing for a long time.
Yeah, she's one of the oldest, longest running. She used to be in orthopedics and now she does regenerative medicine, longevity. She just brought in a new cardiologist named Dr. Abid Husain. He's an integrative cardiologist, so he's going to be speaking as well.
One thing I want to say about Elizabeth Yurth is, when you're in this space for a while, like health, there's a deluge of information, right? And you kind of weight who you get your information from over time based on the quality of the information that they produce. And Elizabeth Yurth is one of those people that, over the years, whenever I get access to anything she does, I'll read it. So I'm super excited for her, as well as Dr. Husain.
Yeah, and they've both been on the podcast too, right? We've had both of them on the Smart and Harder podcast. And Dr. Yurth's podcast with me is one of my most well-liked, the one that I get the most compliments of having her on there. So she's always a wealth of information.
We've got several other people to talk about here. Let's go with Tom DeLauer, right? So Tom, in the health world, is very well-liked, well-regarded, but also a giant influencer when it comes to disseminating health information in reachable ways. So you've come to know Tom the best over the years.
Yeah, he's become a good friend of our company, personally as well. The thing about Thomas that is fantastic is that he doesn't get mired down by doctrine. He understands that there's always going to be nuances, and he has this really amazing capacity to lead his audience in various directions, which is, as you and I know, very difficult, because once you initially he was the keto guy, right? And then everything was keto, but then after a while, it's like, well, maybe keto's not good for everybody. Maybe you need to do other things. But he's willing to take these chances and make these leaps to different things overall. So I'm really excited for him to be there. I think it's going to be a fantastic addition overall.
We also have Josh Holland, Jill Carnahan. We have a number of the faculty speaking as well.
Yeah.
Let's talk about what you're going to be talking about.
That's a good question. I think what I'm probably going to be talking about, tentatively, is that, so Tom DeLauer and I are going to be doing a lecture in June of this year at a place called the Peptide World Congress. And the lecture is going to be on parasympathetic activation for performance. And my sense of it is that I'm going to repurpose that lecture and use it to focus on the GABAergic neurotransmitter system, but in the setting of how we can leverage our parasympathetic nervous system to work out better, both before you work out, during your workout, and after your workout as well. People don't realize that it's not just about revving yourself up and listening to Metallica, which I know you like, before workouts or during workouts. You don't want to be checking your phone between every set. You want to be working on your breathing. And there's very much these aspects that a lot of us that have been even working out for a long time just don't even think about, right?
So I shouldn't be devouring audiobooks while I'm working out.
If it's a relaxing audiobook, maybe. And there's some people listen to audiobooks before they go to bed even. But I think that the key here is that if you leverage the parasympathetic nervous system, you're going to see many, many benefits from a performance perspective. And so many of us are just focused on the revving up capacity of it. And that's important, but what is your reserve? Like, how much load can you put on muscle if you're already in sympathetic dominance? And the answer is not as much as if you were in parasympathetic first. So you can get more of a workout as a result of that. So I'll focus on the neurotransmitters of the parasympathetic nervous system with relation to muscle recovery and synthesis. So we'll talk about things like GABA. We'll talk about the vagus nerve, so acetylcholine. We'll talk about adenosine. Adenosine's a big one. People don't realize with adenosine, if you exercise more, you have more sleep pressure. And adenosine is important for helping us get more sleep. We need more sleep when we exercise more because we have more of that adenosine that's being built up. Adenosine triphosphate, ATP, but the byproduct of it when you make a lot of ATP is pure adenosine.
And so for all of us who suck down a lot of caffeine too, as an adenosine blocker, it's not always the best thing. But other things that we have going on at the symposium, which I'm also very excited about, is, well, first things first, with the symposium, why do we do it, right?
Yeah.
For us, it's about getting the community together. We've been training practitioners now for almost 8 years, I believe, in various forms of health optimization medicine. And the symposium is an annual gathering of those practitioners, and of course, anybody else who wants to join. People who are really interested in cutting edge techniques, tools, clinical information on how to optimize their health. And it's really 2 very rich days of education and, of course, fun.
Yes.
Because we all have to have fun.
Yeah, I think the key there, as you mentioned, is that this is how our podcast is as well. We care about clinical relevance. We're not just talking about theoretical understandings of aging or death or longevity, health span. We're like in the trenches, seeing people, and the clinicians that we bring there are doing the same thing on a day-to-day basis. And that's what we care about, right? We care about actionable clinical evidence that you can use right now with your patients and clients. You don't have to wait for 20 years until the science comes out or whatever. So that's a big emphasis on what we do.
Absolutely. And the fun aspect.
Yeah.
Well, if you get there the day before, there's probably some fun that'll be had. But during the actual conference itself, it's a very limited audience. We're only having 100 people at the symposium. That allows for interactions directly with the speakers. You get to ask them the questions that you want, but also we make it a point of having some sort of nighttime social event. Last year, when we did this in Vegas, we all went to Meow Wolf, which is a collection of art, visionary art. And I found, or at least the reactions that we got were a hell of a lot more positive, because it was somewhat one of those things that I penciled in is like, I don't know if the group will like this.
Yeah.
And
the scavenger hunt.
It was scavenger hunt at Meow Wolf. Turned out to be a huge success. So we'll do something similar this year in Boulder. Maybe not going to Meow Wolf in Denver, but we'll go somewhere else. And it'll be a great time. And
we'll leverage the nature aspect of things too, right? Because we're going to have Josh, you mentioned Josh Holland. He's going to be there. We'll probably do some hikes in the morning, maybe sunset as well. There's so many beautiful hikes. I was just actually up there this weekend with my kids, and you just get into that park, the Chautauqua Park, and you're just like, it's just beautiful. It's the Front Range of the mountains, and it's just glorious.
And for a city dweller like me, it's a great excuse to get out in nature. So it's October 17th and 18th, the Health Optimization Medicine and Practice Symposium. We have a limited number of tickets available, so please go check that out at homehope.org. Boulder, Colorado, which in the fall is really not a bad place to be. So please come join us.